Good evening, class. This is a recording of my reflection on mental health disorders and substance abuse. The surprising thing I learned from this module was the fact that young adolescents as young as 12 years are involved in substance abuse. I am so surprised because I have a 14-year-old and a 15-year-old, and to me they still look so naive. So I'm wondering how a 12 years old girl or boy could be involved in substance abuse. This is a wake up call for me, and the good thing is I know what I'm looking out for to assess and identify if they are into anything suspicious. The not so surprising thing that I saw in this module is the fact that pregnant women are also into substance abuse. I work as a labor and delivery nurse, and I cannot tell you how many times pregnant women have come in intoxicated with either marijuana, alcohol, cocaine, name it, we get them. And it's so sad that some come with placenta abruption because of cocaine use. In fact, just this week, I had a patient who was abrupting due to the use of cocaine and lost a 35-week sweet boy to substance abuse. It is incredible. The lessons on mental disorders that I learned are that people with family members who have depression are 3 times more likely to also have it themselves. And the 3 main neurotransmitters that are responsible for depression are serotonin, norepinephrine, and dopamine. And lastly, the thing I got to know or learn about opioid receptors, which I've always thought were in the brain, are the fact that opioid receptors are also found in the gastrointestinal tract. Lessons on substance abuse that I learned are the fact that substance abuse can lead to a stimulation or depression in the central nervous system. And children delivered by substance abuse may also have congenital birth defects and cognitive impairments. And lastly, the thing that I learned from substance abuse, which I've also mentioned, are the indicators of substance abuse, which include changes in the way of dressing when they don't pay attention to their dressing anymore, if they don't pay attention to their outlook anymore, if they disregard family or friends, and if their behavior changes, it's cause for alarm. On application to practice, as a family nurse practitioner, I think this is a wealth of knowledge that I've acquired in this class as a whole and this module on mental disorders and substance abuse. First of all, I would know what to assess for to determine if a person is abusing substance. And I would also be educating my families on the reality and severity of mental disorders. In fact, which has become very common. It's on a higher, the prevalence is really high, especially in the states where I live. There's a lot of crisis in mental health. And as a mental health nurse provider, I would be able to educate my families as a nurse practitioner. In fact, as a family nurse practitioner, I'll be able to educate my families on what to look for and how to take care of mental disorders. Thank you.